Hello, I'm Jean Pete, and I welcome you back to our show, Better Living. Better Living is brought to you by the Homestead Hope Foundation and is sponsored by Homestead Hospice, where commitment to education and premier hospice care helps patients and families through life's most important journey.
Greetings, everybody. Good morning. I'm Allison Finley. Thank you for joining us today. Jean Pete is taking a well-deserved break. She will be returning soon. Today, you need to settle in with a piece of paper and a pencil. I guarantee we will be giving you websites you will want to visit. Our guest today is Dr. Scott Miller. Dr. Miller is one of 37 physicians with Georgia Urology. It's the largest urology practice in the Southeast. And Dr. Miller is one of 5 doctors in the practice who were recognized in 2011 by Atlanta Magazine as doctors that other doctors trust most. He's also been recognized by U.S. News and World Report as being in the top 1% of urologists in the nation. And, as if that wasn't enough, he's the founder of the nonprofit Prost Aware. Welcome, Dr. Miller. Thank you for joining us.
Thank you, Allison. It's a pleasure.
Why don't we get started with a little bit about your background, your education, and how you came to be where you are?
Well, I'm a urologist practicing here in Atlanta. I've been practicing for about 16 years. For those who don't know, a urologist is the physician that takes care of the urinary tract, kidneys, bladder, prostate, both medical and surgical problems. I've been in Atlanta on and off since 1980 when my family moved here. I went to high school here. I went to the University of Georgia, then the Medical College of Georgia. After being newly married, took my wife out of Atlanta to University of Kentucky in Lexington to do my residency, then came back home where our families are to practice urology.
You and I must be the only 2 native Atlantans in the city now. You are definitely a Georgia boy.
Well, my kids are natives.
And mine are too. Okay. I understand that you're handling, this is not just about prostate issues. Urologists are not. You're mentioning kidneys and bladders and all types of other cancers. So can you elaborate a little bit on that? How do they all affect one another? How do they intertwine?
Well, they're all part of the same system. Mm-hmm. So, and it's not just cancers that we deal with. It's really any disease that might need a surgical option of the kidney, the adrenal gland, the prostate, the bladder. So we take care of kidney stones. We take care of infections of the kidney or the bladder or the prostate. And sometimes when one part of the urinary tract is affected, it affects other parts of the urinary tract.
You have a lot of firsts to your credit in Georgia. The first to perform a laparoscopic prostate removal, the first to perform a robotic prostate removal. Tell us a little bit about some of your firsts.
Well, I was very fortunate being in Atlanta, with all the technology that's available here. So when I came back 16 years ago after my residency training, I focused my practice more on laparoscopic surgery, which is telescopic surgery. Instead of making large incisions to do traditional surgery, it's making small incisions, which is very common. I'm sure most of the listeners have heard about it. The most common procedure being a gallbladder removal. So there are a lot of advantages to that type of surgery in terms of the healing time and the recovery. But it wasn't that common in urology because so many of those procedures laparoscopically were very difficult, particularly with the technology that was available 16 years ago, but I just had a keen interest in it and focused mainly on that technology. And as the technology grew, I grew with it. So we started with laparoscopic surgery and moved on to robotic surgery. Now, robotic surgery is a type of laparoscopic surgery, just with a little bit more technology where we have a computer interface to help us move the instruments.
And you coined the phrase laporobotics.
I did. I coined that phrase because it's the combination of laparoscopy and robotics, again, 2 very related techniques. But when robotics was introduced, it really eliminated a lot of the learning curve in learning laparoscopy for many specialties, not just urology. And so most surgeons, particularly in urology, are traditional surgeons that have learned the laparoscopic techniques using robotics, whereas some urologists, such as myself, started out with laparoscopy and then transitioned into robotics. So it was more of a natural transition and just a little bit different depth of experience.
Most people listening we're lay people. We don't understand the difference between laparoscopy and robotics. So could you elaborate just a little bit more? If you're talking to me and I really am unaware, give me the layman's version of what we're actually talking about between the two procedures?
Sure. Well, let me just back up and define what laparoscopy is.
Great.
So we make a small incision, not much bigger than the size of a button, and we place a little tube in the abdomen, and through that we can place a telescope. And then we can see all the internal organs on television screens. Then we make other incisions, again, small incisions for tubes for our instruments, and then our hands move those instruments in the camera in order to do the procedure. Now that's laparoscopy. So imagine that same setup for robotics with an added layer of technology where once we have all those tubes in place with the instruments in the camera, the nurse then wheels up a machine with floating arms, and I take those arms and I attach them to the instruments and to the camera. Then at that point, I take my gown and gloves off, sit about 10 feet away from the patient at a control console. I then peer through a 3D view of the inside image of the anatomy, and I use these little hand controls to maneuver the telescope wherever I want to see and the instruments wherever I want those to go. The advantage is that I get a little bit more precision because the computer interface can allow a more intuitive movement of those instruments. And I have equal access to both the right and left side of the body, as opposed to reaching over in order to get to that instrument that's located furthest from me. So it's basically living in a virtual world, but it's all real time. So the robot does nothing without my initiating that movement.
I get it now, and I'm fascinated. What type of training do you have to go through to know how to do that? It sounds terribly technical.
Well, again, as I alluded to before, there are several different ways to get to the same end. Currently, a surgeon's going to be fully trained in their specialty to begin with, and most residency programs are starting to teach robotic surgery, so that's probably going to be the way of the future in terms of how the current physicians are going to learn robotics. For those that are already in practice or that have already learned robotics, they already were trained in their specialty, so they know the anatomy and the disease process, and some of them may have some experience in laparoscopy, particularly in fields other than urology, and then they do coursework, and they have proctors and mentors, depending on the level of complexity of the case. The number of cases may vary in terms of what they need in that respect.
And the advantages to this type of surgery over the old-fashioned type, I know one of them that we all know is there's a reduced recovery time. Are there any other advantages that mean something to our listeners?
Well, I think the recovery time is definitely the most obvious, and that'll vary based on how bad the recovery time is from the original surgery. For kidney removal, it's a dramatic difference. That is a very morbid incision, because the ribs are very sensitive, and that's in general the region that we would make an incision to operate on the kidney. For prostate surgery, it's not as great of a difference. It's still a little bit less recovery, but I think the true advantages of laparoscopy, and particularly robotic surgery, is the precision. The prostate is surrounded by some very delicate, important, vital structures, and that increased precision with robotics is where we have the advantage.
When you said precision, you're starting to hit on some words that I think probably are ringing true with our listeners. Men in particular, because I know when I'm around my women friends, when one of us has an issue, everyone is talking about it. Men are not quite as open about it. Men, I think, tend to avoid talking about their health. I'm not really sure why, because I'm not one of them. But when you see a patient for the first time for a screening, are they generally there just because they know it's good for their health, or are they there because they're exhibiting symptoms?
Most of the time it's because we trick them into coming in. No, it's a whole variety, and it's a constant battle that every day I get out of bed and jump in head first to accomplish. Some men are very wise, not just for screening for cancers, but just overall health. They go regularly and check their cholesterol, blood pressure, and all those important things that keep us going. But some we need to educate and pull them in, and spouses certainly help.
Does family history play into this at all?
Really, for most cancers, family history does have a role, and certainly in prostate cancer, it's a big role. So someone that has a history of prostate cancer in their family, particularly with a first-degree relative, a brother, a father, they're going to have a much higher risk of developing prostate cancer.
Are there such things as preventative techniques
Well, we say preventative, but if you really looked at it technically, it would be more early detection. We really haven't mastered preventive techniques for prostate cancer. Now, early detection really is prevention in terms of prevention of symptoms and, of course, prevention of death. But we're still working on the vitamins or the supplements or the lifestyle activities that would reduce the risk of developing prostate cancer.
So when men show up for their screening, and in my mind, tell me if I'm wrong, but women go in for an annual pap smear and men go in for a PSA screening. Am I kind of in the right context?
Absolutely. Men starting at age 40 should have a yearly prostate screening, which includes a blood test, the PSA blood test, which stands for prostatic specific antigen or prostate specific antigen, and a prostate exam, which is a digital rectal exam. And again, along with all the other health maintenance issues.
We realize we're talking about a very sensitive subject. Just from dealing with my friends with issues, I often hear them say, I'm having this symptom, but I'm sure if I wait long enough, it'll go away. So I'm just not going to go see the doctor right now because I'm very busy. What kinds of symptoms should men be looking for if they are not taking heed of your advice and doing a regular annual exam from 40 on? What symptoms should they not be ignoring? What are the real trigger points where they ought to say, this week I'm making that phone call?
Well, Allison, I'm really glad you asked that question. First of all, anytime you have any symptom, whether it's in my area or anywhere else, if something's just not right, particularly if it's persistent or recurrent, seek medical advice. There's never any doubt about that. However, I'm going to turn that question around a little bit in that most men that have early stage prostate cancer have no symptoms. And that's when we want to catch those men. And hence, we want to screen them yearly.
And 40 is early enough?
40 is early enough. We do diagnose some people before age 40, and sometimes it's just coincidence. Sometimes if they really have a very strong history of prostate cancer in their family, some men will screen starting at age 35. But in general, age 40 is early enough.
Okay. I noticed in your notes a phrase that I'm going to hit on very hard right now because I think we've got to get people's attention, and it was the phrase cure rates. So one more time, let's emphasize the importance of the early detection and how it relates to cure rates.
Absolutely. Patients, one of the first questions they ask when they consult with me in the office, what are my chances of this, or this? And typically at the top of the list is cure. And as much as I pride myself in the advancements that we've made in medicine over the last 10 years, it really comes down to when the disease was caught. It's really the nature of the disease more than the nature of the treatment. So you have to be your own healthcare advocate.
All right, give us a little bit more on that. How early is good?
Well, the fortunate thing about prostate cancer in general is that it's a disease of years, not a disease of months. That's one reason we can screen yearly. So
it's a slowly developing.
It is slowly developing, but there are several advantages beyond just the cure in terms of catching it early. The earlier you catch it, the less you have to do. The less you have to do, the lower the chance of having side effects or complications from the treatments.
Okay. All right. Well, and speaking of side effects, you have trademarked an acronym SPECIAL for, and I'm going to get to do this myself because I'm so impressed, sequential preemptive exposure of cavernosal innervation with atraumatic ligation. Did I get that right?
That is awesome. I'm very impressed.
All right. So tell everyone what is so special about SPECIAL.
Well, one of the challenges of prostate removal for the treatment of prostate cancer is those delicate surrounding structures I mentioned earlier. And one of those structures is the neurovascular bundles that provide sexual function to the male. Without those nerves, natural function will not exist. We've learned that those nerves are very delicate. Not only do you have to avoid cutting, burning, or tying these nerves off, you really have to avoid manipulating them in any way. And there are many methods for removing the prostate and trying to achieve those goals. But they all involve methods that might have a little bit of heat, although you try to use it sparingly. It always poses a potential threat to those nerves. There are special types of clips that some people use. In fact, that's probably the most common method right now. But the dissection that's required in order to place those clips can be in and of itself traumatic. So I wanted to come up with a technique where you would minimize any manipulation of those nerves. In fact, not really need to dissect those nerves at all, but rather to just identify where the prostate is and assume that anything in the region of those nerves that's not prostate is related to the nerve function. It's actually a very simple technique, complicated sounding name, which we put into that acronym, but just using a simple dissolvable suture to tie off about half of the blood supply to the prostate, because the blood supply comes in very close to where those nerves are. And by only tying off half of the blood supply, we can stay away from the nerves. And as you get closer and closer to the nerves, the blood vessels get smaller. So often we don't need to even put anything on those little blood vessels, but we have that suture in there, and we can actually, with the precision of robotics, tie off an individual blood vessel at a time. And there are a lot of other little advantages that probably are more technical and beyond this conversation, but it's an example of necessity being the mother of all invention.
Do you travel and teach this technique?
I do, and surgeons come and visit our operating suite and observe.
So this literally was your baby, your invention.
That's correct.
And you also write. I noticed that you do a lot of publications.
I do.
So people are really after you for your knowledge and for your advanced knowledge in not only prostate care, but in all of the issues we were talking about before, kidneys, bladder.
As it relates to laparoscopy and robotics, we can't be a master of everything. Medicine in general is a relatively small community. Urology in particular, and then you narrow it down even further to laparoscopic or minimally invasive surgery. And there's a lot of sharing of information, and that's the nice thing about it.
Elaborate for me a little bit more on the kidney and the bladder infections, because those would also involve the women who are listening.
Correct.
So back up a little bit and let's do the symptoms and what people should be looking for. Again, is it family history? Are there symptoms? What can we be doing to preserve our health?
Well, the topic of infection in the urinary tract is a very broad topic because there's so many different risk factors that can lead to infection. But often there are no risk factors, and you just develop a bacteria gets in the wrong place at the right time. And the symptoms are really any change in the urinary habits. So most people know what their habits are, and they know how much they drink, so they know how much they should be going. And if suddenly they're going more frequently or have an urge and are going small amounts or have discomfort, certainly any fever associated with any of those symptoms, those are always things that would raise a red flag for a urinary tract infection. In terms of it being related to family history rather, if they have some structural abnormality, some of those things run in families, but those are fairly uncommon. Kidney stones are one thing that run in families.
Kidney stones are?
Well, just like it sounds. It's the only thing that belongs in the urinary tract is liquid.
Right.
And it's solid stone material. It's made most commonly mainly made of calcium. And they can cause infection. They can certainly cause pain. They come in all shapes and sizes and locations.
There's so much to this, and it's not the kind of conversation that we're super aware of. I know that Susan G. Komen's doing a great job of making people aware of breast cancer, but somewhere along the way you noticed that we're not getting the education out there for men on the issues that we've been discussing, which prompted you, did it not, to found your own nonprofit?
I did. I feel that Atlanta is a fairly well-educated area of the country. There's lots of access to information here. And over, I would see patients after their diagnosis of prostate cancer that were diagnosed on their very first screening. And when you think about that, that really shouldn't happen that often. The typical course should be you get screening normal, next year screening normal, then unfortunately you run into a patient that their screening isn't normal, then you diagnose that patient. But if you're getting a lot of patients that are diagnosed on their first screening, that means your screening is probably not capturing what you need to capture. So I felt like we needed to focus a little bit more on that education. There really wasn't an organization out there that was solely dedicated just to that. There are a lot of organizations that do prostate cancer awareness, but they mix it with research fundraising, they mix it with cancer support, which is all great. But sometimes that awareness, although certainly passively is getting out there, there's not enough focus on it. So I wanted to come up with an organization that would be focused just on awareness and not really be a fundraising organization. So then the challenge was, how do we get the attention of the males? Well, the first thing that I thought of was sports, but that's kind of been done, and not every man is interested in the same sport. So two other things on the list were music and technology. So we theme our whole organization on our events and our literature on either a music theme, a technology theme, or some combination, because it really can touch a lot of lives through music, and certainly we use technology every day.
And I want to reiterate that this nonprofit is called Prost Aware, PROSTAWARE.
That's correct.
And you have a website?
We do. It's prostaware.org, PROSTAWARE.org. And we have all of our information of any upcoming events. Our annual event is a luncheon at the Ritz-Carlton in Buckhead in September, towards the end of September. And there's a lot of other information on the site in terms of education about prostate cancer awareness.
What would you recommend people do if they wanted to get in touch? If they go on your website for Prost Aware and they have questions, where do they go?
There is a contact page right on the site. All they have to do is click a box on their reason for why they want to connect, whether they want to help participate or they just want information, and put their little message in, and I get that message directly.
And you're saying that there is a majority of people who on their first screening actually turn up with a positive result?
I don't know if it's truly a majority, but it's a large amount, and it probably approaches a majority.
So everybody needs to get to Prost Aware and take a look at the website. That is a non-threatening thing that people can do, that they need to do.
Right.
Men need to get on there and educate themselves. I realize this is a risky thing, but going to the website, I assume you have information there that would prompt them to know what to do next.
It's a very simple yet fun website.
Well, that's great. Great information, great nonprofit. Dr. Miller, I want to thank you for being here and talking to us about this. And once again, Prost Aware, and you are with Georgia Urology in Atlanta.
That's correct.
And I assume you can give them a phone number.
We have a phone number. It's 404-705-5201, and a website, georgiaurology.com.
Thank you so much for being here, and we'll be back shortly after the break.
Hello, I'm Jean Pete, and I welcome you back to our show, Better Living. Better Living is brought to you by the Homestead Hope Foundation and is sponsored by Homestead Hospice, where commitment to education and premier hospice care helps patients and families through life's most important journey.
We're back with Dr. Scott Miller from Georgia Urology, and I want to focus a little bit more on what we were talking about earlier, your nonprofit, Prost Aware. I think it's an interesting story how you came to decide that this is what you were going to do and how you sort of formed the nonprofit by using Susan G. Komen as a model. Can you elaborate on how that got started and what prompted you?
Well, I would love to use Susan G. Komen as a model. That's quite an uphill climb, but starting small, I felt that just focusing on one issue, which would be prostate cancer awareness, and leaving the clinical research, fundraising, and the cancer support to people that do that better. So I think that was one basis for our success so far. We're now into our fourth year and running strong. What prompted me to do this was that the awareness is just still not out there. Prostate cancer has been around for as long as breast cancer has been around. The treatments are advancing as quickly as they are for breast cancer. A similar amount of patients are diagnosed with prostate cancer as with breast cancer, and a similar number of men die each year of prostate cancer as do women of breast cancer. So the importance is definitely there. But males are just different. They don't tend to go to the doctor as often. They don't tend to pay attention to their bodies. They basically take care of their cars better than they do their own bodies in terms of maintenance. So I just felt that the need was out there, and I was seeing that in my own practice.
And I think there's a lack of structural support in this area because, and maybe it's just because women are very vocal about their health issues, you look at the regularity with which women go for a mammogram, women go for their annual pap smear. If I don't show up for my mammogram, my hospital sends me a letter, and if I don't respond to the letter, they call me. There's a very broad structure in place that encourages women and reminds women to get these annual checkups. And I don't see that there's anything in place yet for men, so is ProstaWare going to fill that void?
We're certainly trying to fill that void. To reproduce what women have done over so many years, I think would not be a reasonable expectation. So we have to find other means to get that word out to educate men. And that's what ProstaWare is all about, to try to grab the attention, because we're not going to have systems in place anytime soon for a reminder call or a reminder card. Our society has become far too mobile for that.
So you mentioned earlier that you sort of made the bucket list of what would get men's attention, what techniques you could use to get their attention, and you mentioned music and technology, which I find fascinating. How did that come about?
Well, like I said, we started out with the idea of sports, and that's always a great attention grabber. And my thought is that, at least around town here, a lot of that's already being done and really hasn't been that effective. When someone goes to a baseball game and it's Prostate Cancer Awareness Day, they may not even notice it, and certainly by the next day or so, they're not even going to think about it. So I wanted something that would really infiltrate the lives of men every day. So how do you touch someone every day? You have to think about something they do every day that's common to most men. Well, most men love music. Most people love music. And, like we mentioned earlier in the show, women tend to drive some of the health care of the family, and they often get their spouses to get this preventative care. Technology is something we use every day. Plus, it gives the organization a chance to change with time, since there are so many options to technology in terms of theming our events. It kind of just leaves things wide open. And then there's a lot of overlap between music and technology. So I thought that, well, let's just put those two together, put a little bit more meat on the bone, and just have that be the theme to our organization and carry that in our written and electronic information and any event we have.
And so to that end, being a man of many talents, you're in the top 1% of urologists in the country. U.S. News and Rural Report reports that about you. But you also happen to have a second sort of talent in the background in that you are a musician.
Well, I'm an amateur musician. I probably put myself in the bottom 1% of that, but that doesn't keep me from enjoying it. And I felt that loving music and loving to play music, if we have an organization that's based on music, we should have a song, and kind of a fight song, but not a song about cancer. I wanted it to be a song that really, if you didn't know the context, you could apply to many things in life. So I worked on a song.
Tell us about the song.
Well, what I envisioned, a lot of planning went into it. And actually, the ideas for the song weren't that difficult to come up with. The challenge was putting all those ideas together into one song. The basis of the song is what I would imagine what a patient would be going through when they first learned of their diagnosis. A little bit of uncertainty, but also optimism, saying, hey, we're going to grab this and tackle the issue and take care of it. And that was kind of what I wanted to get across with the song. So the first thing I came up with was the title of the song, Tell It Like It Is, because that's what I think a patient really wants to know.
That's a great title.
Yeah, they want to face it head on. So I came up with that in a separate day, and then I came up with what I thought was kind of the general feel of the song. And I put a lot of thought into what the music should kind of sound or feel like. I wanted it to be kind of uplifting, so I wanted it to be kind of a major key for those musicians that are out there. On guitar, I wrote this on acoustic guitar, although the recorded version, which you could get on the website, is much more refined. Still a demo, but much more refined. I felt the key of E gave us that kind of an open, airy sound, because you can use a lot of ringing open strings. So the main chord progression would be kind of a driving, uplifting beat. So I brought my guitar here. So
and we're going to impose upon you to let us hear the song.
What I came with up on a separate day, a day other than the title, was this simple chord progression. Now that was kind of the start of the song.
Uh-huh.
And I thought that was very uplifting.
It is.
But then I wanted to kind of tell a story, almost a journey. And that's where I ran into some snags until I broke the convention of normal songs. Instead of doing verse, chorus, I felt that chord progression belonged with the chorus. But I didn't want to get into that too early in the song. I kind of wanted to be more of a singer-songwriter style to begin with, and then just do a tempo change in the middle. So I did verse, kind of a pre-chorus to introduce the title of the song, another verse, and then a pre-chorus, and then it would lead into the chorus. And then my ultimate goal is to have this song re-recorded by prostate cancer survivors. That to me is the real thrust of the song.
What a great idea. What a great idea.
We've collected some musicians, but we're still working on collecting some more volunteers that, are professionals, not amateurs such as myself. So that's kind of how the song went together. So I'll play a little bit. So going back to the singer-songwriter style, I wanted to take a similar chord progression, but that one really didn't work at a slower tempo. So I changed it up. So I'm going to do the intro, and I'll just do the first verse and the first pre-chorus, and you'll kind of get the gist of that part of the song.
Okay, great.
How did we get here? Went by like a blink of an eye. Been traveling for hours, but moments never seem to last. So tell it like it is, I'm ready to stand up. This feeling I'm feeling, I'm gonna be alright, just might. So that's kind of how the
wow.
That part goes.
Wow. The hair on the back of my neck is that is great.
So then I wanted to, of course, change the tempo of the song to get into that chorus. And by the way, once I wrote the title on one day and that one chord progression another day, the entire song was written in about an hour. On a rainy day in my house underneath the porch.
When it's right, and things just come flowing, don't they?
Just came together. But my favorite line, other than the title, or two lines, is in the chorus, and you'll hear that in a second. I'm not going to come undone. I'm in this till I've won. And when I wrote that, I thought, well, I've never heard that before, but it kind of seems like a cliche that's been around all the time, and that's kind of why I like that line. And to me, that's a real uplifting part, and it's got a good melody that goes with that part of the song. So what I'll do is I'll just do that last part of the pre-chorus, and then I'll go right into the chorus. I'll just play one chorus so you kind of get the feel of the song.
Okay.
This feeling I'm feeling, I'm gonna be alright. I just might tell it like it is. Don't hold back, I really need to know. I'm not gonna come undone. I'm in this till I've won. Beginning to understand, I'm ready to jump, but where will I land? Tell it like it is.
Unbelievable. I think that answers the question, how does music fit in with the goal of the organization? Did I read correctly that you are looking for a professional group to record this?
I am. So I urge people to go to the website and hear a more refined, prepared version. It has half a dozen different instruments. The acoustic kind of falls a little bit into the background in the last half of the song. But it's on the website, prostaware.org. That's prostaware.org. It's actually in the middle of the donation page. You can download it for free. Right in the middle of the page.
It's very inspiring. We sat here and we've talked about the black and white issues of having an illness, but when you hear a song like that and it charges you up, there is an energy that you don't feel when you're just having a conversation. And the other thing I notice about your song is that I hear hope in the lyrics.
It's mostly all about hope. To make it human, there is a little glimmer of doubt, but I wrote it as if the patient is emerging from that doubt and coming out with total hope.
All right, so besides the song, and you have a website, when was ProstAware founded, and what are some of your other activities?
Well, the idea of ProstAware was started probably about 6 years ago. Coming up with all the ideas, and then, you do nonprofits, so you know this very well. Actually putting it together from a legal standpoint was a little bit of work, but I had a lot of help with that. There are a lot of people that have the same goals I have that are out there. You just have to look for them. And it was started officially about 3.5 years ago. So we are just into our 4th year, and we will be having our 4th annual event, Prostate Cancer Awareness Month, in September. And that's kind of how it all started.
And you have a blue tie event. Blue tie?
Right. The Blue Ties event is at the Ritz-Carlton in September. You can get all the details on our website, prostaware.org. We wanted to appeal to the average Atlantan. We wanted it to be centrally located. We did something a little different and made it an entertaining lunch. And it's a nice lunch. And the reason we did that is we know that men have many excuses not to go to things. And if we put it on a weeknight or certainly on a weekend, we're taking away from their family time and also putting them in the middle of traffic. So we figured, well, most people do eat, and it is a great opportunity for networking, and probably doesn't add much to the day by the time of the end of the day. And if they want to add another 30 minutes or so to their day, they can catch up that way, as opposed to knocking out 3 or 4 hours at the end of the day with traffic and all and getting home. So that's why we do it in the middle of the day.
So your main goal with ProstAware is education.
Correct.
And are there other goals?
That is our goal.
Mainly education, getting people in?
Getting people in. In fact, our target audience is really the undiagnosed. It's not the prostate cancer patient. There are many great organizations out there, and when those patients are directed to our site or to our organization, we help them along and redirect them to where they need to go.
And when they visit your website, what will they see that will allow them to get involved? People are now hearing what you're saying and thinking to themselves, okay, what's my next step? I want to become more educated on symptoms. There's a history of prostate cancer in my family, or simply, I've been educated. I need to go see a urologist. Or maybe they're saying, I simply want to help the organization. Let's go through some of those steps. And when they visit the website, where do they go? What should they be looking for, and how can they help?
Well, it's a very simple website. And when you talk about involvement, you really hit on the key component of involvement, and that's involving themselves in terms of taking care of themselves. So that's the first level. And certainly if they want to be involved in the organization and help us along, there is a contact page that will direct them on how to do that. And we certainly welcome that.
So you're open to anybody and everybody. Give me some examples of people who have contacted ProstAware and how you're working with them. Will you go out into the public? Do you do speaking engagements?
We do speaking engagements. If those are speaking engagements that we are not able to do, we find people that can do those speaking engagements. Since we are all about technology, we highly believe in dissemination of that information electronically. So we have a YouTube page, we have a Facebook page, we have a Twitter handle. We actually produced a public service announcement video that's on our YouTube page. A local TV station actually airs that public service announcement. And we're looking for more and more ideas. So we welcome any and all involvement.
All right. And for people who have now had their button pushed and realize they need to make an appointment, tell us a little bit more about your practice, where your offices are located. I realize it's the largest practice in urology in the Southeast, but tell people how to find you, what the procedure is, how to get started on making that phone call.
Well, let me first say that they should be seeing their primary care physician to have all their health maintenance. I'm part of a large practice, a large urology practice, Georgia Urology. We have practices throughout the metro Atlanta area. We can be reached on our website at georgiaurology.com. If they want to reach me Specifically, my office is on the north side of town near Northside Hospital, and my phone number is 404-705-5201.
Okay, repeat that one more time because everybody didn't have their pencils in their hands.
The website is georgiaurology.com, and the phone number for my office, is 404-705-5201.
Give us a brief idea of where your offices are located around Atlanta. I realize we also have a Phoenix audience and a New Orleans office, and I'm not sure if people contact you, if you can possibly give them a direction to a practice in their cities or not. Can you do that? Do you know?
In Phoenix, I probably don't know too many. I know a few that are in Phoenix. Certainly at the Mayo Clinic, I know those urologists there. But there are many great urologists in the Phoenix area and in New Orleans. And I certainly would be glad to help direct them if I can, depending on what specific ailment they have. Our offices here in Atlanta are down south in Fayette County, north up near the Jasper area, and we have offices east and west. So our furthest offices are about 100 miles apart, so we have over 23 locations.
All right, I want to back up before we have to get out of here and reiterate the fact that you are one of the leading practices in the less invasive types of surgery. Help me with that one.
Laparoscopic and robotic.
Right.
Or laparobotic.
So this is not something to fear, is it? The technology has come so far that the things I think that used to keep people from wanting to see the doctor because, sometimes no news is the news we want to hear. But now that we've gone through all of this, one more time, let's reiterate that we are talking about non-invasive surgery with your trademarked special.
That is correct. It lowers the downsides of the treatment. But some patients don't need any treatment, and most of the time people don't have a problem that isn't easily remedied. The lack of knowledge doesn't change reality. So it's silly not to look for those things when you know you're going to be much more successful both on the cure side and on the side effect side the earlier you catch a disease. That goes for any disease, but it's particularly true for prostate cancer.
There's such a great feeling of relief, I know, from my health, from my friends' health, that when you're worried about something, when you suspect something is there, then it's always sitting in the back of your mind, worrying you. So this is a really simple step people can take. It's just something that you need to do. In the beginning, when my doctor first said to me, Allison, you've hit the age, it's time to have your first mammogram. And I'm thinking, I can't be that old, can I? And now it's just a regular annual thing that I do. You get your teeth cleaned. You have to do these things. And when you do, and as a doctor, you get to call the patient back and say, hey, everything looks fine, then the worry's gone.
It is very simple. Not taking care of yourself and doing these routine screenings for health, it's kind of like writing a check without looking in your account out of fear that you don't have any money to cover that check.
That's a great analogy. It is. And I think it's time to start making people aware. Men need to be aware of this as much as women are aware of the need for a mammogram and a pap smear. And it's just not that difficult. In closing, give people a brief idea when they go in for this type of exam. How long are they going to be there? What can they expect?
Most of the time, it's not the urologist that's doing this exam, although we do many of them. The majority are done by the primary care physician. So it's just a small part, 30 seconds of their entire exam, which includes blood tests for other reasons and examination for other reasons. But if they came just to our office, it's just a few minutes.
Okay.
Painless.
So there's no excuse. It's part of an annual exam. If your doctor finds something wrong, they're sending you to a urologist. It's just not that much to ask.
Well, there are a lot of excuses, just no good ones.
And give everybody your phone number one more time.
It's 404-705-5201.
Thank you so much. Dr. Scott Miller, you have been a great guest, and I appreciate you joining us today and giving us all this great information. Remember, everybody, the website ProstAware is a nonprofit organization. We also want to hear from professional musicians because Dr. Miller has a great song. On behalf of Homestead Hope Foundation, thank you for being here today. Remember that Jeannie Pete will be returning soon. Thanks for listening. And remember, Homestead Hope Foundation is your resource for a healthy life. Have a great week. God bless.